So hemophilia is another genetic disorder that affects, it's a bleeding disorder that affects a body's ability to form the clots. So if a person is having hemophilia, if they get an injury or cut, they will bleed more than normal. So hemophilia mostly affects male and it inherited from parents. So why it's affect males only? Because it is linked to X chromosome. So if you know, remember the father, like the male is X and Y chromosome and the female is XX chromosome. So if the father is affected with X chromosome, having the affected X is chromosome is affected with hemophilia, right? And it is passing down to the boy, and that X is passing to the boy, uh, like uh, and mother is also passing the chromosome to the affected chromosome to the boy, then they are 100% affected, right? So it is a link to X chromosome. Since male have one X and one Y chromosome, if they inherited an affected X chromosome, they will have hemophilia, right? But the female have two X chromosomes, so these usually they are carrier because they will have only one affected chromosome, and to cause the disease, right? They need both XX to be affected. So both parents have to have disease in order to pass it to the females. So types of hemophilia is caused by deficiency in clotting factor. Type 1 is hemophilia A. This occurred due to the deficiency of clotting factor 8. Hemophilia B occurred due to the deficiency of clotting factor 9. So symptoms will include excessive bleeding because they bleed long time after minor cuts and dental work or surgeries. Bruising can occur due to after minor injuries. Spontaneous, there will be no obvious cause for bleeding. Sometimes they start bleeding in the joints or in the muscles, so which leads to joint pain and swelling, lack of mobility because of that, and inadequate tissue perfusion. Complications will include joint damage, a deep internal bleeding can occur, and infection can occur as well, right? Treatment will include replacement therapy of the clotting factor. So we will give them clotting factor 8 and 9 by like the infusions, and desmopressin will be given to stimulate the release of more clotting factor from the bone marrow, and antifibrinolytic agents will be given to prevent clot breakdown. Education will be given to avoid IV subcutaneous injections as much as possible. Ice pack will be given to help with bruising and joint pain. Replacement therapy. Avoid over-the-counter medications such as aspirin, ibuprofen, because these will lead to more bleeding. Non-contact sports are encouraged, like swimming and jogging. They have less chances of having an injury. Medical bracelet should be worn all the time, and vaccine should be given but with small needle, and extra pressure should be applied after giving the injection, right? And also emergency plan should be there in case like a child is going to school. They should inform the teachers, and parents should inform the teachers and school, like they should know in case there is an emergency they can treat it. Okay, next we have thalassemia. Thalassemia is a genetic blood disorder as well. It affects the body's ability to produce hemoglobin. So hemoglobin helps is present inside the RBCs, and it helps to carry out the oxygen, right? So it's a protein that is present in RBCs, red blood cells, that carries oxygen. If you don't have enough HP, then it leads to anemia. So in a condition where body doesn't have enough healthy RBCs to carry oxygen to the tissues. So there is two type of thalassemia, alpha and beta. So these are divided based on the mutation. So if the only alpha gene is affected, then alpha thalassemia, and beta is affected when there is only beta gene is affected. So Cooley's anemia is another condition that is called by beta thalassemia, also called beta thalassemia major. This occurs when both genetic genes affected, right? It leads to severe anemia and the patient needs a regular blood transfusion to treat this condition. So the symptoms will include fatigue, weakness because of the body doesn't have enough blood, pale and yellowing of the skin, decreased growth and developmental. Bone deformities can occur due to bone marrow expansion, and enlarged spleen can occur because spleen is trying to work hard to make more RBC. These are the normal cells, and these will you see malformed RBCs, like it's a square shape and their shape is changing, right? So diagnosis, how will you diagnose this condition? By to check for anemia, blood test will be done, HB levels will be done, then hemoglobin electrophoresis, type of hemoglobin we have, and genetic testing will be done. So treatment will include, because body doesn't have enough RBCs, HB, so we have to transfuse. Iron chelation therapy is done to remove excess iron from the body by caused by excessive blood transfusion. Folic acids will be given supplement. Bone marrow transplant, gene therapy will be the ultimate treatment. So these are the complications. You can see it affects liver, skeletal system, dark skin, poor growth, then hypothermia.